when I mentioned that the child is able to move the shoulder front and back, but the child is not able to lift. So that means the gravity is not there.
Okay.
This CP is treated. This CP is reversible. I mean, if you miss it, when the child goes into complete full-blown CP, you have completely missed it. It's a medical legal case.
In this video, we try to cover the topic of cerebral palsy by going through the clinical scenario of assessment of upper limb neurology. And this is the clinical scenario that was provided to the candidate as a task. I'll be including most of the discussions part later on in this video. So let's see how the candidate performs, and we'll jump into the discussions right after that.
So that's 4 minutes up.
Okay.
You can enter the station now. Yeah, you've got 6 minutes. Yeah.
Okay. Hello, my name is Dr. Maham. I am one of the pediatric doctor here. So, am I speaking to James' mother?
So, mom gives you permission, and you are able to see that the child has got this tube which is coming out from the tummy.
Okay. 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 May I proceed? Yeah.
Yeah.
Okay. So I will start observation. Like.
Sorry, where would you like to examine? Where have you placed the child?
So I would like to place first. I would like to examine while sitting. I will see from the start from the nails. Is there any clubbing, any chylonychia, or any deformity? And then I will start looking in the palm and any sign of any stigmata of chronic liver disease or any and then I will see on the back of the
So the
hand.
palm and the nails, they look normal, pink, well perfused, and they are warm. Yeah.
Okay.
Go on.
Okay. So I will and now and move forward. I will start inspecting the forearm, and I will check for any deformity, any scar mark of any ivy lines
So
and
there is a scar mark at the posterior aspect of the elbow, and towards this side. There's a linear scar like this.
okay, linear scar. Okay, so and I would also I would like to see the any deformity of the bones.
Like
Okay.
what deformity would you? So there's no obvious deformity of the hand.
Okay. Okay, so now I would like to move up in the
And you
arm.
can see the posture. You can see the limb posture and the attitude of the hands as you can see it here.
Okay. Okay, so I would like to move up and would like to see the any wasting of the muscles, any rash, um, mm, any abnormal discoloration of the limb, and now on both sides I will compare the both sides as well.
Yeah. So there's no obvious wasting, as you can see. There's a good muscle bulk observed.
Okay, so now I will start the palpation. And so I will ask the mother. So, Amy, has he have any pain while touching the
No,
arm?
no, no.
Okay.
She doesn't report any pain.
Okay, so I will start from the hand and I will start to check for the tone and tone of the hand muscles, small muscles,
So
fingers.
yeah, when you palpate the muscle bulk for the tone, it's quite some areas are so in this area it's a bit stiff, but the muscle bulk is small.
Muscle bulk is small.
Yeah, but the tone is it's spastic, it's stiff, and the child. Yeah, go on.
Okay, so I would like to check the after checking the tone, I would like to check the movements of the joint and
So
okay, so
when you are assessing the movements of the joint, you can see that the child is not able to completely extend both the hands. So there is a fixed flexion uh, contracture at the elbow,
okay,
and also the wrist is not able to completely extend outwards
okay, there is fixed okay, flexion and no con okay, so
at the elbows and the wrist.
Okay, elbow and wrist. Okay, so now I would like to check the power of the
Yeah.
muscle of
Yeah. How will
will.
you check? How will you
So
check? Can you talk me through?
yes, I will start from the hand,
Yeah.
and I will give the two fingers in the hand.
So
I will.
there's a you can note that there's a weak grasp. The child is not able to grasp your finger properly.
Mhm. Okay, so I will put my hand on the back of the hand, and I will give the command to the child to push my hand.
Child is not able to do that.
Okay, so then I will check the forearm power.
Yeah. How will you check that?
The candidate goes on to complete the rest of the structure of examination as the video follows. However, for the sake of brevity, we'll jump directly towards the discussion part. And if you'd like full access, please let us know.
After the Viper thing, looking at the patient. Um, so if the patient is again well and well, I'm repeating it again myself every time. So if the patient is well and well, if there is any dysmorphism, how is the patient growth? You would like to plot, and then you have mentioned microcephaly, although you did identify it, but these are the things that you would like to look in the initial part, and then looking around the patient again. The child has
Weak
is in a
patient.
wheelchair, is in a assisted wheelchair with a body strap, and the child has got gastrostomy peg tube coming out. Can you see this peg tube?
Okay.
And then you have the next breathing, which is with the gravity.
Yeah.
Okay,
Yeah.
so the active movement against gravity, yes, I would say. So I'll just rephrase this. So active
Yeah.
movement against gravity, and then this one is the uh, against gravity and resistance
Yeah.
and resistance. Okay, and
Yeah.
then this is the normal power. Break it down.
Yeah.
Let's start with what's the classification. How do you classify CPs? Would you diagnose CP at say 9 months of age,
By 1 year, I think.
12 months? So the
Yeah.
no, you the ideal age is 24 months, and then you have the hypotonia, and the mixed group can be a combination of all of these causes. So try to go through the causes. What are the causes of CP? Which is your torch infections, your chromosomal problem, and your malformations. Mimics. What are the DDs of CP? Can anyone tell me? Or something called as the mimics of CP or impersonators of CP. Yeah,
Metabolic
Pedro.
encephalopathy.
Yeah, metabolic ones. So the most important, as you said, any space occupying lesions as well. Intracranial space occupying lesions like a hematoma or a tumor,
Yeah.
and and this can result in your hydrocephalus, and with or without hydrocephalus, and you have structural brain which you mentioned, and then metabolic conditions. uh, the most important is glutaric acidemia type 1. Try to remember this. You know why? Because this can also mimic type 1. This can also mimic shaken baby syndrome. You can have multiple hemorrhages in the brain, and when you do a CT scan, you will see that the child has been shaken terribly. That will be the inference, but it's actually glutaric acidemia type 1. So this is in an NAI they may ask you. Uh,
I didn't know this, Rise.
yeah, this
Thank
is
you.
this is quite. I mean, one of favorite questions. Metabolic. You had this glutaric acidemia type 1, and then you have something called as the GLUT transporter, which now is let's just touch upon something called as the GMFS classification, because this is a topic that you cannot get away with. You cannot appear for your MRCPCH exam without preparing for this topic. Yeah, I hope it's useful, because I think cerebral palsy, it's a quite deceptive topic as well, because Most of the times we think that we know this topic, we are well aware, but the questions, when the kind of questions it comes from the examiner, we may get caught out.